This is KSUT Public Radio. Regional News is next. Since President Trump began his second term, Immigration and Customs Enforcement has stepped up raids and arrests across the country. This has created a climate of fear in immigrant communities, which is fueled both by confirmed arrests and by false reports of ICE activity. The Colorado Rapid Response Network runs a 24/7 hotline to help verify reports of immigration enforcement around the state. It's a project of the Colorado Immigrant Rights Coalition. For the Rocky Mountain Community Radio Coalition, KGNU's Jack Armstrong spoke with Keely Leon, CIRC's North Regional Organizer.
We want to make sure that our community is able to go to these spaces that they frequent without having to pause their lives. Our community still has to go to school. They still have to take their kids to school. They still have to go to work. So we don't want their lives to be on pause for an unverified ICE reporting. So we have a Facebook page where we post these and community can access them and say, oh, ICE was confirmed here, or ICE actually, that wasn't. Maybe that was a different agency, but it wasn't ICE.
I know there's something called confirmers who go out and confirm if ICE was there or not at any particular suspected incident. But could you explain a little bit more?
We have been training folks across the state of how to interact with ICE agents or even law enforcement, because there may be a couple agencies at a certain area, but we train them how to speak, how to get information, how to verify that it is actually ICE. But within the team, it's pretty big. We have not just the confirmers who go on the ground and our trained volunteers. We also have trained dispatchers. So those are folks that are answering the phone. We want to make sure that they're 24/7, that they're able to take on these shifts. They're also bilingual. We want to make sure that they, one of our members of the community is in a crisis, that they fully are able to communicate and understand them. We also have legal confirmers. So those are folks that are able to go onto the scene if a confirmer has said, hey, there is ICE here, there is ICE presence. We need someone to start writing down what's happening, to observe if there's any constitutional violations or anything of the sort. So it's a pretty big team, a lot of volunteers, but it's a well-run machine, and it's, depending on community and how much folks are willing to volunteer their time.
If someone sees a forum post, like on Reddit or Nextdoor, they're not a confirmer, they're no way in part of CIRC, but they have CIRC's number maybe. How should someone react, especially if they fear that they're a potential target or they know a potential target of immigration enforcement?
We have been seeing a lot of that, like even Reddit, like you're saying, folks just reposting unverified things or, without actually knowing. So what we're encouraging folks is to maybe ask the original poster, like, hey, could you maybe call the rapid response line or give them a call yourself and ask, hey, I'm wondering about, this sighting. Are there any updates on it? Anything of the sort. And we can get confirmers on the scene, just because we don't want to repost things that aren't verified. Like I said, we don't want to put people's lives at pause without an actual verified sighting.
What happens after something is verified as not being ICE? And how should the community know that it's safe in that area?
So once a confirmer goes, for example, like they figure out that it's actually police activity, that there is law enforcement on the scene, but they've identified themselves as law enforcement and they are not ICE. And so our confirmer has verified that there was no ICE presence. What they'll do is tell the dispatcher, and one of our team will go onto the Facebook and we'll post. We'll say, no ICE activity, confirmed. So folks will know that that's a safe area to go into, that there was no ICE and that has been confirmed. There are some circumstances in more of our rural areas where confirmers can't get on the scene on time. And unfortunately, right, we know it's unconfirmed, but there could have been ICE, but they didn't detect any on the scene when they arrived. So, that's where volunteers come in. We want to grow this network, especially in our rural areas.
Keely Leon is the North Regional Organizer for the Colorado Immigrant Rights Coalition. Reports of ICE activity can be submitted at coloradorapidresponsenetwork.com, where organizers work to confirm and share accurate information. This is Regional News on KSUT Public Radio. Rural hospitals are not delivering as many babies as they used to. That's led to a return to midwives to help fill the gaps around our region. The Mountain West News Bureau's Hannah Merzbach takes us to one birth center in southern Wyoming.
Near an I-80 off-ramp in Evanston, across from a Chevrolet dealership, there's an old white house. Upstairs, it has a tattoo shop.
We'll have screaming down here and screaming up there.
Because down here, midwife Jana Hartzell delivers babies.
This is the birth room.
Aside from the inflatable tub for water births, the vibrant space looks like a bedroom with a queen-size bed, purple walls, and yellow curtains.
To make it feel like you're at home when you're having your baby versus like cold, sterile hospital feeling.
Midwives specialize in natural births and fewer drugs. They don't have as many years of education as OBGYNs, but are trained to handle low-risk clients and transfer them to a hospital if things don't go according to plan.
We take on women who are experiencing normal physiological pregnancy.
The idea for the birth center first came about when the local hospital delivery unit shut down last year. It said it didn't have enough patients and was one of 100 rural units to shut down since 2020 amid rising costs.
What are people going to do now?
In Evanston, the situation left many pregnant people driving at least an hour to Utah.
Some people don't have a way of getting down there.
So Hartzell and another midwife pooled their money and opened the birth center. Others, like Sarah Morey, are doing the same. She co-founded a center in Cheyenne a couple years ago, but said there's still some challenges around insurance.
We're basically eating $4,000 to $5,000 per client.
Specifically those on Medicaid, which in Wyoming doesn't cover the fees that go towards birth center facilities and administration. Morey is lobbying to fix this with state lawmakers, many who already see midwifery as a way to fill care gaps. But there are other hurdles.
It's then the hands-on training.
In order to get a degree, midwives need to attend a certain number of births in person. And there's just not enough midwives to teach them.
It's hard to feel confident without finding high-volume centers to apprentice at.
In states like New Mexico, where there's state-sponsored apprenticeship and a long-standing nurse midwife university program, which Abby Reese runs.
Community traditions were preserved.
She says midwives were marginalized decades ago by mainstream medicine, but in New Mexico, Indigenous and Hispanic communities help keep the practice alive. There, many state lawmakers are on board.
Who will say something along the lines of, my grandmother was a midwife, or I was born at home.
In New Mexico, midwives attended more than a quarter of births in 2021, twice the average of other states in the region. But Reese wants even more, most care to come from midwives, like in some European countries.
With physicians in consultative roles, so that we can leverage that precious workforce.
Some states have a shortage of physicians, OBGYNs, including Idaho and Wyoming, where lawmakers have passed abortion bans. Those states are training family care doctors to fill the void and take on more complicated pregnancies. And Arizona, Montana, and Nevada recently launched nurse midwife university programs. For 19-year-old Rustin Mitchell, midwives are part of the solution. She had her first baby in that Evanston birth room.
There was a point where I was like, oh my God, I can't do this. Somebody give me some drugs.
But she pushed through, and afterwards got a home-cooked meal from midwife Jana Hartzell.
Jana cooked me a pulled pork sandwich, gave me a nice glass of orange juice, sliced cheesecake. I was on top of the world.
And she felt at home with her healthy baby boy. For the Mountain West News Bureau, I'm Hannah Merzbach in Evanston, Wyoming.
Support for local and regional news on KSUT Public Radio comes from the Colorado Housing and Finance Authority.